Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today we're talking about concussions in youth sports and how they can affect your child.
A concussion is a temporary disturbance in your brain function after you have a head injury. And because your brain controls all the areas of your body, it can be any kind of symptom. So commonly it's headache or dizziness, but it can be something as simple as I'm just not thinking right, I'm just not feeling right. It can be ringing in your ears.
How prevalent are sports-related concussions each year?
So we actually don't know exactly how many concussions occur each year. It's probably very underreported. A lot of athletes probably don't talk to their doctor about the head injury, or they don't get officially diagnosed with a concussion. We estimate about 300,000 closed head injuries that result in a loss of consciousness each year, but it's possible to have a concussion without having a loss of consciousness, and it's quite possible that a lot of these injuries don't get reported to the doctor.
What sports have the highest frequency of concussions?
The highest rate of concussions in men is in football, and that's followed by ice hockey, then lacrosse, and then soccer. In women, it's a little bit different. The highest rate of concussion is actually in soccer, and then that's followed by lacrosse, basketball, and softball.
What should a parent do if they think their child might have a concussion?
I think you should follow up with your doctor. The treatment for a concussion is to take it easy, to rest, to take yourself out of commission. But I think it's important to get evaluated by a doctor first. First, they may be able to help you control the symptoms of the concussion by medication. They can give you advice on how to deal with your concussion going forward. And also, it's important to see a doctor to make sure you're not missing a different diagnosis that's masking as a concussion.
What is the recovery time for a concussion?
The recovery time for a concussion varies in individual people and depending on how severe the concussion is. In general, 85 to 90% of concussions will get completely better in 7 to 10 days. But unfortunately, there are some more severe concussions that can go on for longer, up to weeks or even months.
Why is it important to allow for a full recovery?
First, while you're recovering from a concussion, you're more susceptible to getting another concussion. And that can be because while you're participating in sports with a concussion, you might not be as sharp. You might get blindsided by that linebacker you otherwise wouldn't have allowed yourself to get blindsided by. You might not be as good with the puck playing hockey, and you're skating with your head down and you get blindsided by a defender. Also, while you're recovering from a concussion, your brain itself is more susceptible to getting a concussion. So with a lesser impact, you might have a new concussion. And rarely there are some devastating consequences from getting a concussion on top of not recovering from your first concussion.
How can a parent tell if their child is ready to return from a concussion?
Returning from a concussion, you have a gradual return to play. So the first step after a concussion is just shutting down, giving yourself 24 to 48 hours of no activity at all. In kids, you then want to get them back into school, and then when they can tolerate school fully, then you reintroduce light exercise, followed by more moderate exercise, then you're back in practice. And when you're back in practice and scrimmaging fully without any concussive symptoms, you're then probably ready to get back in and participate in the next game.
What risks are associated with repeated concussions?
Every time you get a concussion, it seems like it takes a little bit less to get that next concussion. That hit that maybe the first time wouldn't have given you concussion, that next time will. And that seems to be somewhat additive, that it just keeps getting easier and easier to get a concussion. If you recover fully from each concussion, it doesn't mean you're going to then have lasting brain damage. And a concussion, by definition, shouldn't have any sort of lasting impact. It's a temporary brain disturbance. But you could see that if it's happening easily, that you're getting concussion just by minor impacts in sports, it may take you out of commission as an athlete.
Would you allow your child to play a sport like football or hockey?
I played ice hockey growing up and still play ice hockey, non-contact at my age, but I think that the lifelong lessons you get by participating in sports far outweigh the risks of concussion. Concussions have always been a part of sports. It's great that we're recognizing them now so we know how to treat them and have athletes fully recover before they get back into sports. But the benefits of sports in kids with friendships, teamwork, learning how to exercise, forming lifelong exercise habits are far greater than the risks to concussion. So I would let my son participate in any sport that he would want to.
Has concussion awareness gone far enough?
I think the fact that we're becoming more aware of concussions is terrific. It's definitely still an evolving topic. So we're still sort of learning what exactly a concussion is, what the molecular changes are in the brain that lead to a concussion. Even the basic treatment, and as I mentioned before, the treatment is sort of a gradual return to play. That seems to be changing. We're now sort of seeing some research that returning someone back to school and light exercise earlier might actually be beneficial. And you could see that in kids, if you tell them to sit at home, don't do anything, don't see your friends, don't do any, think about whether you have a headache. They're going to sit in a room and give themselves a headache, and they might get depressed or they might get deconditioned, and maybe we're prolonging their symptoms by taking them out for so long. So it's a constantly evolving topic, and it's great that it's getting a lot of attention and that we're learning how to understand it better. I guess my fear with sort of the amount of publicity and awareness of it is that we go too far and then keep our kids out of sports or have, take them out of any situation where they might risk getting hurt. And a concussion by definition is temporary and they'll completely recover, so I wouldn't want to see that happen. As an emergency room doctor, when I see a kid with a closed head injury, sort of my first step is to figure out, do they have a head bleed, which would be a much different treatment than a concussion. And we're fortunate to live in this day and age where we have some great predictive rules for whether a kid will have a head bleed or not. And if we're nervous, we can always get a CAT scan to prove it. In the emergency room, we can't diagnose a concussion. We sort of have to see if symptoms persist in the days to come. But sort of back in the day, we said, don't let your child sleep, if they may have a concussion, and that's actually not true. That was sort of to figure out if they had a head bleed, and we want to keep evaluating them, so we want to have them sleep and decompensate in their sleep. Nowadays, we want you to sleep if you have a concussion. We want you to rest because we're so good at teasing out whether there's a head bleed or a concussion.